You made a name for yourself back in April by placing on the door of your office, and the sign is still there today, I noticed, that said, if you voted for Obama, seek urologic care elsewhere.
I wanted my patients to realize that elections have consequences, and this is a big deal. This is probably the worst piece of legislation to come through Washington ever. It's interesting how Washington or government can intrude on medicine for 50 years. No one bats an eyelash. I put up one sign suggesting that I have a problem with our president, and everybody goes crazy.
But does it also suggest that you might have a problem with some people who agree with the president?
I'm not turning anybody away, and I never ever initiated any conversation about politics.
Do you think you've lost any patients because of
I've lost about 12 patients, but my new patient appointments are up about 300%.
Might some of them who might have some reservations going to see a urologist, period, be made all the more anxious by seeing a sign like yours?
They can go to another urologist. There's another gentleman in town who says he's a Democrat.
You've also said that if someone were to read your sign and turn the other way, then so be it. Is that a contradiction?
No.
Why not?
It's totally up to the patient.
You spoke before the governor made his budget presentation on Monday in Eustis at the Tea Party event.
Sure did.
Of course, in the past year, you've also been quoted as saying that the whole thing, meaning the legislation, is a big joke. Why?
It certainly is.
Why is providing health insurance to people who previously were denied insurance a big joke?
There are 2,000 new regulations to the healthcare bill. Out of the 2,000 regulations, there are two that sound somewhat okay. The pre-existing condition clause and the if you want to keep your kid on your insurance until they're 26. The rest of it, so 99.8% of it, is crap. I think that we need healthcare reform, but this thing needs to go away.
And what about just providing insurance for 30 million or so Americans who don't have it right now?
The 30 million people that don't have health care, a lot of them are people who choose not to have health care, about 30% of those people.
Are you a supporter of Governor Rick Scott?
Yes, I am.
Is there a potential problem privatizing state mental health facilities, which is something that the governor is calling for?
I'm not sure.
If you leave that in the hands of private operators that are profit-driven, that possibly the care could be diminished?
The government doesn't do anything right, so I don't look at privatizing something as a negative thing right off the bat.
One of his task force recommends giving doctors that are treating Medicaid patients immunity against lawsuits malpractice. Is that a good thing?
I don't think doctors should have immunity.
Funding for rape crisis counseling, which could disappear as well.
Yeah.
Is that something that you would support?
It's not something I'm familiar with.
Would you support that?
Probably not.
So you might not support all of Governor Scott's healthcare-related policies or recommendations that have been made to him?
I might not support everything, but I think we need to get rid of Obamacare. That's the thing.